Good morning. It's Ida, Master of Social Work in Private Practice. And today I want to talk about akathisia. Akathisia is a movement disorder marked by a distressing sense of inner restlessness and a strong, often uncontrollable urge to keep moving. It's often described in terms of what it feels like, which is an inability to sit still, pacing, rocking, legs swinging, or shifting weight. There's an inner tension, like an agitation or crawling discomfort, and it's reported to be worse when trying to relax or stay still. This is not just physical, it's usually very mentally uncomfortable too. Akathisia is most often a side effect of medications that affect dopamine, like antipsychotics, some antidepressants, and anti nausea drugs. The treatment focuses on reducing your symptoms and addressing the cause. So that would be adjusting your medication by maybe lowering the dose, switching to a different drug with lower risk, or stopping the offending medication if safe. I just want to preface that anything to do with adjusting your medication, you should be doing in consultation with your doctor. If you're going to add medications to relieve your symptoms, those would be beta blockers and benzodiazepines. And I would say consult with your doctor to find out more. You can do your own supportive steps, which would be reducing caffeine or stimulants in your life and monitoring closely so your symptoms, because they can be severe and distressing, it's better to catch this in the early stages. So I just want to do a comparison between akathisia and tardive dyskinesia, TD for short, because some of the symptoms and what you're experiencing may be similar, but there's unique features to both of these. So although they're both movement disorders, akathisia, the core problem is an inner restlessness, where the core problem in TD is involuntary movements. In akathisia, the sensation is often a strong urge to move, where TD, usually there is no urge, but movement happens automatically. The movement type in akathisia is purposeful, it's pacing, it's shifting, whereas in tardive dyskinesia, it's repetitive, abnormal, lip smacking, protrusion movements. The timing in akathisia, it often starts soon after you're increasing or taking a new medication. In tardive dyskinesia, it usually develops after long-term use. Is it irreversible? Well, in akathisia, it often is if treated early. Is it reversible in TD? Well, it can be persistent or permanent, but there is hope that it can be reversed. The subjective distress in akathisia is very high. Patients feel it intensely, and tardive dyskinesia may be less distressing initially. So, just to explain about TD, it's another medication-related movement disorder, but instead of restlessness, it causes involuntary repetitive movements, especially of the face, mouth, and tongue. So why the distinction matters? Because akathisia is often acute and highly distressing, requiring quick action, where TD is usually chronic and neurological, requiring long-term management. So the good news is that I've created guided meditations, and I'm going to post the meditation in the comments section or description section of this video for akathisia. If you want to find the tardive dyskinesia guided meditation, scroll down and it'll be there for you. So I just want to thank you for showing up for yourself today and go gently throughout your day.